I do this because it feels great. And I do it because it feels great to be able to do it. And I do it because I have to do it. I have a condition called diabetes, type 2 diabetes. Now, some of you watching this movie maybe just found out that you have this condition yourselves. You're feeling down? Huh, tell me about it. I've been there. So let me tell you about my life with diabetes. The day the doctor told me I had diabetes, I was scared real bad. I had an uncle that had it, and I saw what had happened to him. And I saw how he ended up, blind with no legs. And I could see it all happening to me, not being able to work, and not being able to provide for my family, winding up like my uncle. Man, I tell you, life was not looking any too good. But it isn't turning out that way. Today, I feel better than I felt before I took sick. When I went to the doctor, he gave it to me straight. Told me what would happen if I just let it slide. Said that I could end up like that uncle, but I didn't have to end up like my uncle. That if I took care of myself and stuck to my diet, exercised, and took my medicine, that I could have a pretty good life. Not that there wouldn't be problems, but I could keep on working. I can enjoy my family. You know, I'll never forget what he told me.
Mr. Priestley, diabetes is a chronic disease. We have no cure for it. We can only control it. As in many other chronic diseases, the input of the patient is very important. Yeah. The more you learn about it, the better you will be able to cope in your life with this disease. Since we put you on the diet and the exercise program, you have lost a tremendous amount of weight. Your blood pressure is now normal without any medications. Cholesterol has improved. Your sugar, however, remains elevated. I'm going to give you a medication that I want you to take. Now, this medication is going to help bring your sugar down. But remember, a pill without adhering to the diet and the exercise program is not going to work. The type 2 diabetes that you have can be controlled with diet and exercise programs. It can never be controlled with a pill only.
Doctor, what does this mean?
Well, it means that this medication is going to help your body to bring the sugar down to normal. And if we can control the sugar in a normal range, and since we already improve all the other risk factors, you are not going to get those dreadful complications of diabetes that we are all scared about.
Okay, I understand.
Mr. Priestley, let's talk a little bit more about diabetic complications. The most common cause of blindness remains diabetes. Patients with uncontrolled diabetes mellitus can develop more heart trouble than patients who don't suffer from it. And you can die from a heart condition. It can also affect your kidneys, and it can give you painful neuropathy and infections that they are sometimes very difficult to control. You don't have to worry about it. If your sugar remains normal and your other risk factors remain stable, you won't get these complications. Remember, stick to the diet the diabetes educator planned for you. Continue your exercise program. I want you to continue monitoring your blood sugars every day. And most important, don't forget to take that pill that I gave you. You have to remember, Mr. Priestley, if you're in charge of your disease, you can control diabetes rather than let diabetes take control of you.
When I heard those words, that my life was in my own hands, I was still scared. But pretty soon I could see it was good news. And if I could do something about this sickness I had, I would do it. I'd do whatever I had to do.
One of the major differences having diabetes made in my life was in food shopping. I found that I could continue eating many of the same types of foods that I had always enjoyed. Only now I have to prepare them a little differently. Of course, I was overweight. I'd been going on diets for years, cutting out this and that. I'd lose weight for a while, and then somehow I'd find myself gaining it right back. Finally, my husband, bless his heart, told me to stop torturing myself. He said, "I like you just like you are right now." So I didn't think about losing weight much. But then when I found out I had diabetes, there were no two ways about it. I had to lose weight. And the funny thing is, it wasn't torture anymore like it had been. I knew that down one road was a good life, feeling good, looking good, being healthy. And down the other road was so horrible, I don't even want to talk about it. I've always really enjoyed cooking. Sometimes after a day at my job, making something delicious for dinner is the high point of my day. I still feel that way. Having diabetes hasn't changed that. I make a lot of the same dishes I used to make, only now some of the ingredients are a little different. I read the labels. I keep away from products that have a lot of sugar in them. You'd be surprised how many products that you don't think of as sweet have sugar in them. So I look real close at the labels. The higher up the list of ingredients you find sugar, the more sugar there is in it. You always have to read the label. The whole family eats a lot more vegetables. Used to be the vegetable was like a penance. I'd make broccoli, boil it till it was soggy, and my husband and the boys would get down a couple of mouthfuls. Now I have a lot of new ways to make different vegetable dishes. For instance, with broccoli, I steam it for about 3 minutes, and I serve it with lemon juice and a few drops of hot sauce. And believe you me, it tastes like a totally different vegetable. Now they wolf it down. It's funny. The way we eat doesn't feel like a sick person's diet. We eat just the way millions of people do, who want to be more healthy and active. Like fats. If you're using kind of fat or oils that are solid at room temperatures, like butter, lard, or bacon fat, then you're using the wrong kind. You should try to use fats and oils that are liquid at room temperature, like olive oil or vegetable oils. Your own doctor will tell you just how much fat and oil you can have in your diet, but I'm just giving you a few tips from what I've learned. And I didn't get my nutrition information out of a magazine or from a friend. I learned it from what they call a certified diabetes educator. She also set up my exercise program.
Exercise is one of the important parts of your treatment regimen. As a matter of fact, it is as essential as the other 4 components that we've already talked about. And as you know, they are controlling your weight, right? Eating the right kind of foods, testing your blood sugars on a regular basis, and taking your medication. Exercise is just as essential as any one of those. The type of exercise I'm talking about actually can be something as simple as walking. Walking is probably one of the best forms of exercise that you can do. A brisk walk, a half an hour every other day, is very, very helpful. And you can add exercise into your daily life. For example, you can park your car maybe 3 or 4 blocks away from where you're going and then walk. How about taking the stairs instead of the elevator or the escalator, right? Or taking a walk on your lunch hour. Just the fact that you have diabetes puts you at higher risk for developing heart disease. So you can see then why you need to exercise. Exercise not only helps you to lose weight, it also can help lower your chances of developing a serious heart problem. Now, exercise also has a kind of special effect, and a beneficial one for people with diabetes, aside from what we've already talked about. And that is that exercise actually helps insulin to work a little bit better in your body. Now, I know most of you here, in fact all of you here, have non-insulin dependent diabetes, and you may not have to take extra medication. However, your body still makes insulin. And what exercise does is it helps your body to use that insulin in a more effective and more efficient way. And what happens is it lowers your blood sugar levels and helps control your diabetes. So you can see then, the fact that you have diabetes makes it very, very, very important that you add exercise to your routine. Now I'm going to show you how to check your heart rate so that you know that you're exercising long enough and hard enough.
I do this every day. My goal is to get my heart rate to 130 for 15 minutes every day. Once I got into the habit, I was surprised at how easy it was just to do it every day. Part of my daily routine, just like brushing my teeth or taking a shower. Pretty soon I found out that with exercising every day and the way the family was eating, I began to shed pounds easier than I ever had before. The more weight I lost, the easier it was to exercise, the better I felt. Every part of my life got better. I actually feel much better now than in the days before I learned I had this illness.
Since your diabetes was diagnosed about 8 months ago, you have a much healthier life. Your activity has increased, your diet is better, you look great. All the risk factors we talked about, like hypertension, high cholesterol, high blood sugar, are under control now. I want you to continue the same way, and I hope you feel as great as you look.
So, starting right then, I started to lose weight. And I could see that I had plenty of reason to. It wasn't just a question of being able to get into my old pair of pants. It was a matter of life and health. And believe me, I still enjoy sitting at the table, but I know that one of my top priority jobs is to keep my weight under control.
I learned how to shop, how to cook, and how to eat in a way that was more healthy for my whole family, not just me. We all still enjoy eating a lot, only now I prepare our food better. I feel so much better now, there's no comparison. I know I have to stick to the diet my doctor gave me.
I always liked working out, but then it got to where I was too busy or didn't have quite the energy. Now I know I have to exercise to keep healthy, and the energy just flows back. Regular exercise is one of the best parts of my day.
One of the things you learn being a diabetic is that more than with most illnesses, you have a lot to do with your own treatment. You have to check your own blood, see whether the treatment is going right. It's not hard, but you really have to keep on top of it.
The most important thing is, follow the treatment plan your doctor gave you. Do it for yourself, do it for your family, take your medication exactly the way your doctor prescribed it.
I actually feel much better now than in the days before I learned I had this illness.
And if I could do something about this sickness I had, I would do it. I'd do whatever I had to do.